The eardrum, partition between the external auditory meatus or external acoustic meatus and the cavity of the middle ear. Middle ear is potentially space between the medial wall and the tympanic membrane of the middle ear. So, the medial most part of the external acoustic meatus, this is the isthmus, 5 millimeters medial to isthmus there is eardrum, also known as tympanic membrane. This membrane is fibrous membrane. It is flexible but tough, and it is very thin, translucent membrane, and forming an angle of 55 degree with the floor of the external acoustic meatus. So, when we examine the external acoustic meatus, the anterior wall and floor are longer than the roof and the posterior wall of the external acoustic meatus. So, the tympanic membrane or eardrum. Also known as ear drum. The oval in shaped. It is not round, measuring 9 to 10 millimeters, and the thickness of this translucent or semi-transparent membrane is only 0.1 millimeter. When we talk about the weight of this membrane, it is only 14 milligrams. So, these are the measurements of the tympanic membrane. The three-layered membrane, this is three-layered membrane having outer, middle and inner layers. All three layers represent the three layers of the embryo, or when there is the third week of intrauterine development of the fetus. During embryo life, it is having ectoderm, mesoderm and endoderm. So, outermost layer of the membrane develops from ectoderm, middle layer from mesoderm and innermost layer from the endoderm. So, these are the measurements of the tympanic membrane. When we draw the section of the membrane, This is the external acoustic meatus. And here an angle of 55° formed between the floor of the external acoustic meatus and the lateral wall of the tympanic membrane. So, there is formation of an angle of 55°. This is the innermost layer, the mucosal layer. These are the nuclei. So, mucosa. This is low columnar. These cells are not very tall and not very small. These are between the cuboidal and the tall columnar cells. The low columnar cells are forming the innermost layer or the mucosal layer of the membrane. This is the middle layer formed by fibrous tissue. It is formed by the fibrous tissue. It is again having two layers, the outer and the inner, or the superficial layer and the deep layer of the middle fibrous layer. This outermost is cuticle or cuticular layer. And formed by the skin. So, three layers are seen here. The outermost skin, the cuticular layer, the middle is the fibrous layer formed by the fibrous tissue, and the innermost layer is the mucosa layer, and it is formed by low columnar cells. Now, when we talk about the middle layer of this tympanic membrane or eardrum, it is formed by fibrous tissue. But before moving on the microanatomy of this middle layer or fibrous layer, I will talk about the structure of the tympanic membrane, which is having two parts, a tense part, larger part known as pars tensa, and small triangular part, the pars flaccida. So, it is having two parts. When we see the tympanic membrane we examine from inner surface, the circumference of the tympanic membrane is comparatively thicker, and it is fixed in tympanic sulcus of the tympanic temporal bone. This part is fixed in the tympanic sulcus. Tympanic sulcus, but the posterior superior part of the tympanic sulcus is deficient. There is no tympanic sulcus or groove inside the temporal bone to accommodate this tympanic membrane. So the tympanic part of the temporal bone is having a notch here. This notch is known as tympanic notch. Notch. This is the tympanic notch. Two folds are running from this tympanic notch. And attached on the lateral process of the malleus. Two tympanic folds running downwards and inserted or attached to the lateral process of the malleus bone. There are three ear ossicles in the middle ear cavity: the malleus, incus and stapes. And this is a long process known as handle of the malleus. The membrane is concave from its outer part and convex. This is the outer, so this is concave, and this is the inner, which is convex. So it is having concavity outwards. And when we see the right, this is the right tympanic membrane, it is directed laterally, forward and downward. So it is forming an angle of 55 degree with the floor. So this is the direction of the tympanic membrane, laterally, forward and downwards. So this is the direction of or face of the tympanic membrane. When tympanic membrane is examined, it is illuminated from this side. So this is the part of maximum concavity. So here of cone of light, when we illuminate, this is the farthest part, and a cone of light is seen in this part of the membrane. Cone of light. Is seen here. And here we can see the long process of the incus. This part, the larger one, is very tense and known as pars compacta. This part is known as pars compacta. This part is having three layers: outer cuticular skin layer, middle fibrous layer, which is again having two layers: the outer or superficial running radiating fiber and deep running circular fiber, which are more dense in its periphery and less densely placed in its center, and medial most is seen and formed by the mucous membrane in this pars compacta, but a small triangular gap between the anterior and the posterior malleolar folds is flaccid part, loose part, and this part, which is formed by loose connective tissue and replaced by loose connective tissue, the fibrous layer is replaced. So this part is flaccid and loose part. So this part is known as pars flaccida. This is known as the pars flaccida. So before moving on the fibrous layer, I will again explain the two parts of the membrane between the anterior and posterior malleolar fold. This part is having three layers: outer skin, middle loose areolar connective tissue, and innermost part is formed by mucosa, the low columnar cells. But this part, which is tense part, why this part is tense? Because this part is having pull of a muscle which is attached on the malleus, this muscle. This muscle is known as tensor tympani. Because this is tensor of the tympanic membrane, so name is tensor tympani. One more muscle is also seen in this part, which is known as stapedius muscle, small muscle and related to the hyperacusis and hypoacusis in some diseases of the facial nerve. But this muscle is not innervated by facial nerve, this is innervated by the mandibular branch of the trigeminal nerve. So this part, the pars tensa, it is having the middle fibrous layer. This is the pars flaccida. This is the pars flaccida, and remaining part is the pars tensa. So this is the pars flaccida. And this is the pars tensa. This part is having inner circular or deeper circular, which are more densely placed in its periphery, but seen scanty in its center, and outer radiating fibers or superficial or radiating fibers. These are the radiating fibers and these are the circular. So in its periphery, in its deeper layer, I am talking about this fibrous middle layer of the tympanic membrane, which is very well developed in its pars tensa part. This part is tense due to the pull of the tensor tympani muscle, and outer radiating fiber and inner circular fiber. The density of circular fiber is more in its periphery, but these are scanty in its central part. So this is the fibrous middle layer of the tympanic membrane. Now, what is the function of this tympanic membrane and how this plays important role during hearing or during understanding the sounds? When we hear, what happens? The sound waves are coming from the atmosphere and entering through the concha to the external auditory meatus. The sound waves are coming from this side, and these sound waves are projecting on the tympanic membrane from its lateral part, and these sound waves are vibrating the tympanic membrane. The tympanic membrane is having its attachment to this bone, the malleus. This malleus is attached to the incus, and finally the third bone, the stapes, is also attached. I will talk in detail when I will talk about the middle ear, but the very simple explanation of this is the again the anterior posterior folds, this is the handle of the malleus. This part, the part which is having maximum convexity, this part is known as umbo, U-M-B-O. These sound waves are transferred to the other bone. This is the malleus, the incus, and the third, the smallest bone of the body. The stapes, and there is attachment of a muscle, the stapes muscle. The other muscle we have seen already, this is the tensor tympani. So finally, these sound waves vibrations are transferred from the stapes to the cochlea, and cochlea is having hair cells which are the real receptors of the sound. These receptors are converting the sound waves and vibration in the accent potential. This accent potential is transmitted to the brainstem through the cochlear part of the vestibulocochlear nerve, and finally the sound or the hearing is appreciated in the cerebral cortex from connections between the brainstem and the cerebral cortex, which is having some auditory areas. When there is a pus formation in the middle ear cavity, the pus is drained from the posterior inferior part. When we divide this tympanic cavity in 4 parts like this, the part number 1, 2, 3 and 4. One important nerve, not only important but very important nerve, the chorda tympani, is passing through the middle ear cavity in deeper part of the pars flaccida. It is superficial to incus but deep to the malleus. This is the chorda tympani. When we illuminate the tympanic membrane, this nerve looks like a cord, so it is known as chorda tympani.